Welcome back to another episode, Marvels, where Dana and I have hit the record button and immediately forgot what we were talking about.
Yeah. And I think all of our episodes start with us laughing, because that's usually what we're laughing about. Like we'll literally say 5 seconds prior, we're going to talk about this. And then you'll hit record and it's like we're two deer in the headlights.
What? Well, are we selectively mute though?
See? There it is.
See?
Situational anxiety. Yep.
Situational. So we wanted to do an episode today about the downsides of incompetent therapists.
Yeah.
I want to say, like, I have, vocalized on the channel and on our show how much I hate trolls, because I'm like, go take your negativity somewhere. What I really love is that we had someone in our community really kind of not challenge, but offer a different opinion than what we were talking about, but in such an insightful, beautiful way. Dana and I love that. I mean,
it really pulled us to want to talk about it. So
yeah, because, and so yay you, and you know who you are, yay you, and thank you for taking the time. Yeah. I mean, there are some of our audience members who listen to each show and they really take the time to be thoughtful. They comment. I mean, it's like, we love you so much. And when Dana and I have merch, we're going to have to reach out to you and send you some merch for sure. For sure. Yeah. And so it really brought up like the damage and the harm that incompetent, specifically non-neuro-affirming therapists can do. Yeah. I will say, as a therapist, so my specialty really is, I only play with neurodiversity because obviously it's the only fun thing to do. It's the only place to be. And what I see, because many of my clients will come to me from other therapists, sure. And here's what I see. Traditional insight-oriented therapy, what I mean by that is psychologists will say talk therapy. Mm. And it's really this idea that insight is the only thing that's needed to drive change. Mm. What I find with my clients is that talking about something over and over and over again amplifies, almost re-traumatizes, right? Brings up distress. Mm-hmm. And then when nothing is done to help identify a replacement, to identify a coping strategy, to practice something together, to make a change, to make an actual practical action or skill or behavior change, because that person wants it. If I don't help connect those dots, I leave my client re-traumatized. Right. And this is something that I see over and over again. I think the other thing that I see is, so I see this in traditional insight-oriented therapy, but I also see this in CBT. And, CBT is only good, in my mind, my professional opinion is that CBT is only right for people who have metacognition, meaning I can think about my thoughts. Oh, right. I can measure my thoughts and compare my thoughts against something else. Mm-hmm. And I have enough cognitive resourcing to change my thinking so that I can get to something else.
Yeah, and the thing being worked on is typically linear.
Yeah.
Which is not at all how neurodivergent people think. Yeah.
No, right. So I think so there are some dangers and pitfalls. So like when people come to me and say, do you do CBT? And I'm like, only if appropriate. Yeah. Do I do some cognitive restructuring? I absolutely challenge thoughts. I absolutely restructure thinking. Absolutely. But that's collaborative and that's by consent. Yeah. And I think that the other pitfall that therapists can do is, we've been taught this in grad school and in our clinical rotations, right? That you got to measure behavior on what's reasonable, right? Like what's reasonable. Right. That can be very dangerous in the hands of some people, because then that message of, well, that's not normal. Right. Well, why can't, you're just not trying hard enough. Whoa, you're not doing enough. Yeah. Because if you did, and you would be compliant or you'd be adherent to my recommendations, Danger. You guys, if you bump into that with any therapist, and whether you're neurodivergent or not, or wherever you are on the spectrum of neurodivergence, get out of that work.
And some of what the person who is making the comment said, which is really, and all across therapy, neurodivergent or not, is what you're talking about re-traumatizing. We call it recapitulating trauma.
Yep.
So there are tons of therapists out there, unfortunately, that will wade into doing trauma work with somebody, and they have no training in trauma-informed care.
Oh my God.
And so, the first thing you do when someone, and I've been doing trauma-informed care for a little over 30 years now.
Oh my God.
And the first thing I was taught, and the first thing I do is something that's called resource installation. You don't jump right into a trauma unless they're in crisis and you might be processing it. But you have to make sure the person can handle what comes up. You have to go at their pacing, and it has to be context specific for that person. So for example, if I've worked with someone for a while, we have a rapport, they trust me, we've got all these things in place that for them help them deal with uncovering a layer of trauma. Also bringing in like the neurodivergence piece. Let's say we talk about a trauma and they dysregulate. And then for them, doing a particular behavior is regulating, rocking, playing the same song over and over, shutting down, watching the same movie on a loop 3 times in a row. And a conventional therapist who doesn't know anything about neurodivergence, even if one that knows trauma doesn't know neurodivergence, they're going to say, what did you do to deal with it? They said, I watched the same movie 3 times in a row. They're like, well, that's terrible. You're avoiding. No, they're regulating. And so me as a trauma-informed and a somewhat of an expert on neurodivergence, I'd be like, oh, okay, we need to pull back a little bit. We need to not go as deep because we pulled you apart too much. We need to go slower. And that's what we mean. I think that's what some of the comment was. Some therapists will just rip the Band-Aid off and they have no idea how to deal with what comes up, and they haven't worked with the client to put that in place to begin with. That is a problem just in general across all therapists. And if you have someone that's doing that and just wants to dig in there and they haven't done any of that rapport building or resource installation, they don't know what they're doing, and you should run.
Yes. And how about not saving part of the end of your session in order to put Humpty Dumpty back together again?
Yeah, exactly.
Like, I think for me, I think about my own work. So doing my own work as a client, right? Which I really do believe that therapists should have done their own work before coming into doing work with others. I would talk about difficult things, and, if that didn't get stitched back up or closed back up in a way that I could leave, I don't think, I'm very, very good at putting myself together and putting on a brave face. I'm very good at that. I learned that very early on because of my own history. So that's one of my compensatory strategies, which has served me well on the outside, but is awful when I'm like, what is that for? Like, what do you want, Gwen?
Yeah.
I don't know. I've never been allowed to ask that question. What do you want? Right? Like, oh, I get to choose? Like, wow. That didn't come to me or come until lots of work and coming into my age, right? Like allowing myself to do that. But that's the sign of a good therapist, by the way, you guys. Like, so let's talk about some of those characteristics. One, they build a relationship with you. They get to know you. They understand that neurodiversity exists. Let's start there.
Like minimal.
Minimal. That they check what kind of resourcing you have already.
Yeah.
What ways have you managed, your big emotions or your stress or, in the past? What do you rely on? How effective do you think those are? How easily can you get those? How easily do you use those? Those types of questions. Yeah. Then we structure the session so that we always have a way that the session begins and ends. And that is super important to understand how I open and close back up, how I constrict.
It's the container of the therapy.
Right. Yeah. That's necessary, you guys, just as a framework. Ask that therapist how they work with trauma. Ask them how they work with neurodiversity. Ask how a typical session goes.
Yeah.
If you're just getting together and just elaborating or opening things up and there's no insight, nothing at the end of it, that is probably an area that you might want to it might be a red flag. I mean, I think that would be a red flag. The other is when a therapist gets mad with you because you didn't do your homework.
Yeah. Oh, I never get mad at people. It's more like, what's going on there? Was it my agenda for the homework, or was there something that was too much? I've had clients that we've changed their session time from the beginning of the workday to the end because they've held back because they don't want to go to work with clear evidence they've been crying.
Yeah.
That's a good trauma-informed therapist to be like, oh yeah, okay, let's let you do that and then see how it goes, because maybe you needed that force to pull back and get yourself back together. But yes, absolutely. They should never send you out the door, scoot you out the door without you being, my therapist to say, without you being big again, meaning like you're adult. Because I did a lot of work of early trauma stuff. And some of those, when we were doing the insight pieces, if I went to a place that felt really young, there wouldn't be a ton of words, but there'd be some. Yeah. And I could stand up again and I could go out the door and we would talk about it the following week when I've had a chance to integrate it. So all therapists that are doing this well will find that sort of, I call it that rhythm with you, but it should have all these pieces that we're talking about in dealing with trauma for sure. Yeah.
Yep. And then asking for permission too. Like, so, maybe you brought up something in the session previous. And, sometimes some of my clients, if it's not in their present minds, they forget about it, but it doesn't mean that they don't want to work on it. So I might say, hey, last week we were working on this. Do you want to continue that or do something else?
Yeah.
I just put it out there. Like it's totally up to you. Some of my clients too, like don't underestimate the power of a very, very long rapport building phase. Yeah. So this is another thing that therapists will say, like, I only have 13 sessions because of insurance. So I need to fix a problem in 13 sessions. For many of my clients, they want to understand that I get them. And that can take months.
Yep.
Months. I go to extreme measures to connect with people in the beginning phases of therapy. And for some, it's like it's taken a year. So they'll be like, I'll see you for half an hour every other week. Okay, now I'll see you for an hour every other week. Now I'll see you every week. That, for some of my clients, that takes a year. Yeah. And we're talking about their experiences in life. And we're not doing any type of pressure or challenge. Right. And then we'll get to this place where they're like, hey, this came up. So I let them move that. But I think a lot of times people would say I'm a very ineffective therapist. I see my patients or my clients for a very long time. Some of them, from when they were little all the way to now they're married and they have a job, whatever, right? Yeah. And it's like, wow, I'm either a really good or a really bad therapist. I don't know which one it is.
No, I think trauma-informed care does talk about that, and rapport building and keeping that level of trust is so key. I don't think I cried in therapy until I was in therapy for over a year.
Yeah.
Right. And I can remember thinking, is this person going to hurt me? And it took that much time to be like, okay, and then let out a little bit and then see how she would respond. Is it going to go well? Okay. Oh, okay. I'm going to let out a little more. I can trust you. Absolutely. And you're talking about years long therapy. It isn't so much that we're like, oh, now we have to unpack this super deep stuff that we haven't gotten to in the last 4 years. A lot of it is kind of like maintenance, especially if you have someone that needs that lattice work outside, and a neurodivergent person's probably more likely to be that. And just to keep you on the right path. Even I have clients that are incredibly insightful who are not neurodiverse, who I've worked with for years, and it's been because of that. We're going to deeper layers, but it's different for everybody. Yeah.
And that, the routine and the consistency of that relationship and that the structure of the session, these things are very regulating for people. Right. And they can be very regulating for people. And so they just see that as part of their self-care.
Yeah.
Exactly. I've many of those clients that are like, this is part of how I take care of myself. This is how I don't let things build up, because when I come into this space, I know what it's for.
Yeah, exactly.
So I use it in that way.
That's right.
And those are some of the signs. So those are some of the flags and signs of good therapy.
Yeah.
Dana and I often, we feel really strongly, I think, about the damage that therapists can do. And it's not that we're saying we're right and they're wrong. What we're just saying is there are so many dimensions to therapy for neurodivergence that have to be.
Yeah.
And what works for a neurotypical may or may not work for a neurodivergent person.
Right.
But I will tell you, if you successfully and effectively and beautifully support neurodivergent people, you will be an exceptional therapist for a neurotypical person.
Absolutely.
Because of all the dimensions. And so if therapy doesn't feel right to you, if you don't feel validated and supported, get out.
Yeah.
You can still feel validated and supported and still be challenged in therapy.
Yeah. But still feel
those
like
are not,
Yeah.
Right. They're not mutually exclusive, you guys. And so I think a lot of times, if I'm getting validated and supported, they're never challenging me. They're never helping me grow or build or do something, right? It's like, oh no, but you guys, that can happen simultaneously. You can feel validated, supported, seen, and understood. And your therapist can still be like, I've noticed something.
Yeah, exactly. Yeah.
Right.
Yeah. And can give you a sense like you can, the comment we had gotten was they were aware of being hurt by this person, that they were not, it was more about them and their judgment than themselves. And first thing I thought was, I'm glad you left. The second thing was, I've had clients even say to me, when you do X, Y, or Z, it doesn't work for me. I'm like, awesome. Great. Glad you told me. And that should be probably, they can say that because I set that vibe of, you can do that in here. Yeah.
So the word that we were trained with in grad school was iatrogenic.
Oh, okay.
It's basically an illness or caused by a medical examination or a treatment. So it's something that, like, when I was a grad student, we talked about the iatrogenic.
Oh yeah.
Problem, which is, can you as a therapist cause harm?
It's almost like nosocomial infections in a hospital. The infections you get while you're in there. Yeah.
Yep.
Yeah.
Can you cause harm? Yes, therapists can cause harm.
Yep.
Yes. Yes, we can. Yes, we can.
And I would actually say they can cause more harm because of the power differential and how much you open up to them. They have it can be like a little kid wielding their father's gun, which can be scary. Very scary.
Yeah. So follow your guts, you guys. Follow, at the end of the day, your therapy should feel supportive. At the end of the day, it should be supportive.
Yeah, and it's okay even if it doesn't feel like a good fit. I'm really happy that most people that come to therapy with me stay, but I've had some that left. And I'm like, it's okay. I know I'm doing good therapy, but we're not a good fit, and it's totally within your right to go and find somebody else's. It's fine. Yeah,
absolutely, and please do.
Yeah,
please do make that decision for yourself. Please do. And by the way, you guys, if a professional says something, it doesn't mean that it's always right. Okay, that's another thing. Clients will be like, "Oh, I've seen 3 different therapists. It never worked for me. Therefore, it must be me."
Oh, yeah.
There's something wrong with me then, because these are professional people. They know what they're doing.
Yeah.
And the reality is no.
I think I've
they
said
didn't.
on here, it's like 3 to 5 therapists is the average for people to find one that really drives. And I do think that's because it is such a personal relationship.
Yeah.
That it goes beyond skills. It goes to your personality fit, and does the way that person do themselves fit with you? And it's okay to move on if they don't.
Yeah. We know that in the literature. We know that it's not the type of therapy that is practiced for effectiveness. It is the fit of the client and the therapist that makes the most difference. So no matter what model of therapy you're in, usually the fit with your therapist will be the determining factor for effectiveness. So you get to change therapists. You get to say no. You get to say no, thank you. So please feel empowered to make those decisions for yourself. Because heaven forbid, Dana and I, we know that our colleagues can unintentionally do harm, still harm.
Yeah.
Anyway.
Exactly. Yeah.
I'm giving them the benefit of the doubt. All right.
Okay. Yeah.
All right, everyone. Be good to you. We will see you in the next episode. Bye.
Bye, everybody.